Mahora Tuki wasn't sure what she wanted to do when she finished high school last year.
I thought I wanted to try tourism, I wanted to try lots of other stuff, but I didn't really think about healthcare. I thought it was quite hard. I didn't have any family members in it, so didn't know much about it, didn't really think I could.
Then a career advisor suggested Te Whatu Ora Waitaha's Whakamana Whānau program. Mahora gave it a go, starting off in a midwifery unit before switching to become a radiographic assistant.
I've noticed that I've become more extroverted, and especially with the Whakamana Whānau backing me up, I've become a bit more confident knowing that there's some support behind me, so I can, talk to them and get their support in helping me.
She now has her sights set on a Bachelor of Medical Imaging. Without the program, Tara Saul says she wouldn't have finished her studies to become an enrolled nurse.
There was times where I'm like, I can't finish my studies, I can't do this. There were a lot of barriers because I've got dyslexia, but I keep fighting and I keep pushing through, and with support from my whānau and my classmates and everyone, I did it.
This week she starts her first shift on a Burwood hospital ward. Her experience, like others, has sparked interest from whānau and friends.
My brother is an orderly at Christchurch Hospital, which he started in this year's program, and he's loving it. He talks about it every day.
Helen Tutingaihe studied Māori health inequities before retraining in the healthcare space herself. Whakamana Whānau encouraged her back as a kaiawhina on a Christchurch Women's Hospital maternity ward, and she wants to keep learning.
I'm really wanting to get into paediatric nursing, so I am looking at this stage of going back to study part-time as well as keeping my job here part-time. It's been something I've been wanting to do for a long time, but I feel like now is the right time to get down that pathway, and I'm really looking forward to it, and I'm really grateful to have the Whakamana Whānau wrapped around me as well.
Rebecca McCormick, Te Whatu Ora Waitaha and Tētai Potini's Head of Equity, Diversity and Inclusion, says the program has been a success.
We have had 3 intakes in Waitaha, Canterbury, and we've appointed 80 kaimahi Māori and Pasifika into the workforce with an outstanding retention rate of 93%. We've had 1 intake in Te Tai o Potini, the West Coast, and we've appointed 5 healthcare assistants into that role.
It's also won a National Development Award. John Snook, Director of Workforce Planning and Development, says Whakamana Whānau is in the process of being expanded across the motu. He says ideally they'd like to see 200 to 300 people go through the course over the next 2 years.
What we know is our best workforce is our locally grown workforce. These people are already committed to the system. They're working in it now. And we're committed to them, and this is a way we can work in partnership to grow them, their expertise.
Te Whatu Ora Waitaha's Chief People Officer, Joe Domigan, says it has big benefits for patients too.
Our patients will get a better service from our hospitals if they're well represented here. So it's really important for us that our kaimahi, our staff, match the patients that are within our services. So at the moment we know we've got about 12% Māori in Canterbury, and we've got about 5% of our workforce identify as Māori. So we've got some ways to close the gap so that we better match the populations.
The next intake begins on the West Coast this week.